Hey everybody, welcome to Clear Talk for Clarity Hearing. I'm Dr. Scott Marquardt, audiologist and owner of Clarity Hearing. Today our topic is going to be ringing in the ears. And we have with us our special guest and expert on all things ringing in the ears, Dr. Katie Miller. Welcome, Dr. Katie.
Thanks so much. I'm happy to be here.
So, what's the real name for ringing in the ears?
Great question. So there are two pronunciations for tinnitus. The first one being tinnitus, where you have mostly clinicians and researchers using. The second one is more common around the general population, pronounced tinnitus, but either one is acceptable.
So now what is tinnitus?
Tinnitus is a blanket term for any sound that someone hears without an external source. It can be described as many things, the most common being ringing, but it can be described as other things too, like whooshing, roaring, crickets, clicking, buzzing, the list goes on.
So it's more than ringing, it could be any noise that somebody hears inside the head.
Correct.
Okay. I think we all know somebody that has this. How common is it?
So tinnitus is fairly common, affecting about 15% of the US population, which comes out to be around 50 million Americans. Of those, about 20 million have bothersome or burdensome tinnitus, and 2 million have debilitating or very extreme cases of tinnitus.
Wow, that's a lot. So Dr. Miller, what are the most common causes of tinnitus?
So there are many different things that can cause tinnitus. It's good to know that tinnitus is a symptom of some underlying condition rather than a condition in and of itself. So the more common things to cause tinnitus include obstructions in the outer or middle ear, such as a wax buildup or a fluid buildup from an ear infection. It can be caused by head and neck trauma, TMJ, traumatic brain injury, sinus pressure. The list goes on, stress and anxiety, but the most common link has been hearing loss, with about 80% of people reporting tinnitus also having coinciding hearing loss as well.
So when I went to that concert and I walked out and my ears were ringing, so it's noise exposure.
Yes, so one thing that can really spike the volume of someone's ringing, or however the person describes it, is noise exposure. As someone who has tinnitus myself and that also likes to go to concerts, I have definitely noticed if I leave a concert that my tinnitus is louder, especially if I've forgotten to wear my hearing protection. Now, this can be true for any type of noise exposure, including working with power tools or lawn mowing. So it's important to remember to wear your hearing protection whenever you find yourself in those types of environments.
So do you find that patients who are stressed or high stress individuals or worrisome or focus on the ringing, does that make things any worse?
So that's another thing that can make it louder or happen more frequently. Stress and anxiety is definitely a big contributor, along with hearing loss, to how often you're hearing or how loud the tinnitus may be.
Are there things I can do to make it go away or soften? What do I do?
That's a great question. So there are many things that we can do for tinnitus management. It's important to remember or know that tinnitus is often a symptom of some other underlying condition, not a disease or condition in and of itself. So by treating that underlying cause, you can often reduce either the amount of times you hear the tinnitus or the loudness in which you perceive it. The most common cause being hearing loss. Oftentimes by treating the hearing loss, we can reduce the perception of the tinnitus, but also managing other things like you mentioned, stress and anxiety, keeping up with proper sleep, getting good diet, even sometimes meditation and yoga can help as well.
Okay.
In more extreme cases, cognitive behavioral therapy has proven to work really well too.
So psychologist?
Yes, any psychologist, psychiatrist, or other mental health professional.
Okay. And so if I have tinnitus and it bothers me, what should I do?
So the first thing to do would be to get a hearing test. And if you're in the Houston area, you can call us at 936-273-4437. Something else to note is most of the time you have tinnitus or ringing in both ears. If you are noticing it in just one ear, it might be good also to see an ear, nose, and throat physician in your area.
That's good advice. Okay. Thank you. Thanks for joining us today.
Of course. Thanks so much, Dr. Scott.